Everyone, and a warm welcome to our audience in the Kellogg Hub and to all of you who are joining us virtually from wherever you are around the world. We're so delighted to have you with us. I'm just going to run through a couple of very brief housekeeping points before I hand over to our speaker this morning. And it's just to note that the session is being live streamed and that we've got a photographer and a videographer with us. And I'd also like to ask people just to put their mobile phones on silent or turn them off before we start, please. There'll be time at the end of the talk for questions. And for those of you who are with us in person, just raise a hand and we've got a microphone that we'll bring to you. For all of you online, my colleague Nicola is on the chat, so please put any questions into the chat and we'll read the questions out on your behalf. Okay, so without further ado, I'm delighted to hand you over to Alistair Ross. Alistair.
Well, good morning, everyone here in the room. Good morning to people who are online, and I appreciate that you might be online at some other time zone. So whatever time zone it is, you're welcome to share, and please ask questions if you would like. So at some stage, I'm going to be sharing the screen when it's relevant, but I'm just going to begin by saying a number of things. I've been writing about Freud for quite a few years, and what I want to do is to tell a bit of this part of Freud's story, because cancer is not generally spoken about other than in high-profile cases because of the unsettling nature of its existential threat. The idea that a part of our body can turn against us and kill us if untreated is profoundly disconcerting. Yet every one of those affected has a cancer story to tell. They want others to know the details, as if in telling their story, the impact of the trauma is lessened through the powerful human connection in being listened to. Freud has his own cancer story, which we shall listen to today. Because while many people have heard of him, not many people are aware that the last 16 years of Freud's life was dogged by cancer. In March 1923, Freud was aged 66. He was at the height of his intellectual abilities. He'd revised key structures of the human psyche in a complex dynamic balance of id, ego, and superego. His fears that the First World War would destroy the international psychoanalytic proved unfounded. His straitened financial circumstances improved with the return of well-paying American patients and their dollars at a time when hyperinflation in Germany and Austria was rampant. His daughter Anna was proving to be a promising psychoanalyst and in fact expanding the field into working with children alongside her colleague and then later rival Melanie Klein. Yet still he grieved the death of his middle and favorite daughter Sophie, who had died in the influenza pandemic in 1920. So Freud, the great explorer of the psyche, with its complex defenses and denials, was in denial about cancer. In 1917, he discovered a lesion on his palate, thought to be an epithelioma, the pre-cancerous growth that requires removal to prevent it becoming cancerous. He reported this to his Hungarian colleague and friend Sándor Ferenczi, that it had disappeared and took no further action. This was no doubt influenced by the fact and by the fear that he would need to give up smoking his beloved cigars. The quote, "A cigar is just a cigar," is Freud's most famous quote, which he never actually said. Freud grew up in the aroma of cigar smoke, because his father Jacob smoked cigars, and Freud began smoking as a medical student aged 24. He acquired a liking for cigars, which he smoked exclusively, following in his father's footsteps, who smoked cigars until his death in aged 81. While separated from his fiancée Martha in 1884, he attributed his increased smoking to her absence, writing, "Smoking is indispensable if one has nothing to kiss." One wonders about the oral fixation that Freud built into his ideas of how the psyche develops as a person grows. Later, part of Freud's daily routine was an afternoon walk around the local park and then a visit to the tobacconist. And I shall just share the screen. Okay, and then, the Austrian author Robert Seithaler has written a sensitive story about a young man and his friendship with Freud during the Nazi occupation of Vienna, based on their daily encounters at the tobacconist. This is the title of the book and the movie. Ernest Jones, a British psychoanalyst and Freud's first major biographer, records that his earliest collaborator, Wilhelm Fliess, told Freud in 1894 that his heart arrhythmia, that is Freud's heart arrhythmia, was due to smoking and to stop. Freud replied, "I am not obeying your smoking prohibitions. Do you really consider it such a boon to live a great many years in misery? Smoking has rendered me such service during my life that I can only be thankful. Without it, I could not have worked as hard or as long as I did." Yet Freud did try and managed 14 months without smoking, but found the depression too much to bear, and so his nicotine addiction continued. Again, in 1900, writing to Fliess, he laments, "I am not allowed to smoke anything decent. Alcohol does nothing for me. I'm done begetting children." So from this point on, we need to put some context. Freud smoked between 10 to 20 cigars a day. When visiting his half-brothers in Manchester in 1908, Freud commented that the cigarettes here and Holland were much better than those, quote, "miserable Bavarian weeds." These were his usual trabucos, a small cigar, the best available in Vienna due to a tobacco monopoly held by the Austrian government. Freud also wrote, "The English are a really agreeable people and the cigars are excellent." This was the first time he met his nephew Sam, and so Freud advised him, "My boy, smoking is one of the greatest and cheapest enjoyments in life, and if you decide in advance not to smoke, I can only feel sorry for you." One of the privations caused by the blockade of Austria in the First World War was the shortage of food and cigars. So his wife Martha and her sister Minna bartered their needlework and some of their wonderful creations, which were given to the lady in the tobacconist shop in order that they could get Freud an increased allowance of cigars. Freud was actually somewhat irritated when the men around him did not smoke, and he preferred Don Pedros and Reina Cubanas that friends or patients gave him as gifts. Anyway, he had some wealthy friends in Hungary who sent Freud food parcels during the war, which included, most importantly, a further selection of cigars. Yet in 1921, Ferenczi expressed concern about Freud's workload and his many, many cigars. In fact, patients of Freud's have recalled in their own writing that there was something distinctive about being in analysis with Freud, because you would go into the room and you would lie on the couch and there would be this waft of smoke. It gave them a sort of special sensory connection. And then later, a poet, H.D., who saw Freud in the 1930s, recalls in a Jewish allusion that here is where you experience, quote, "the smoke of burnt incense." Then, when leaving Vienna in 1938, Freud wrote to his younger brother, Alexander, Your 72nd birthday finds us on the verge of separating after long years of living together. I would like you to take over the good cigars, which have been accumulating with me over the years, as you can still indulge in such pleasure. I no longer can. So this is a picture, a characteristic picture of Freud taken in 1921, and it's the cover of the book that I've had published this year, which is a reference guide to Freud's life and works. Copies are available. Please buy them for your libraries. But returning to March 1923, Freud realized that the growth on his palate had returned, and possibly it had never gone away. He could ignore it no longer, so in April he consulted Max Steiner, a dermatologist and a member of the Victoria Psychoanalytical Society. Steiner told Freud it was a leukoplakia and advised him to stop smoking, but Steiner already thought it was malignant. Dr. Felix Deutsch, Freud's personal physician at the time, visited 2 days later, and Freud said to him, "Be prepared to see something you won't like." Deutsch was in no doubt it was a malignant a squamous cell carcinoma of the palate, but to gain time told Freud it was a leukoplakia that required surgery. Freud was more concerned about giving up smoking and what he believed it would lead, which was a loss of creativity. He felt this was a bigger threat than physical discomfort or suffering. So Freud then made an autocratic decision that nearly killed him. He approached Marcus Hajek, professor of laryngology at the University of Vienna, to do the surgery, despite some misgivings about him. Hajek had a good reputation as a researcher, but according to Dr. Max Schur, who became Freud's personal physician, he was a somewhat mediocre surgeon, not qualified to operate on a malignancy involving the resection of the maxilla. During World War I, the Vienna Surgical Clinic had established a special department of oral surgery directed by Professor Hans Pichler, who later performed the radical operation on Freud that was necessary. So Freud turned up at Hajek's outpatient clinic, was operated on, experienced extensive bleeding that was difficult to control. Hajek tried to admit him to hospital, but it was full. So Freud spent the night at the ill-equipped clinic. His family were telephoned and asked to bring in items for an overnight stay, which was the first they knew of his illness or his operation. His wife Martha and daughter Anna delivered these, but were not allowed to stay because it was not visiting time. So Freud was left unattended. He hemorrhaged again. The other patient in a cot in the room was a mentally retarded deaf-mute person who also suffered from dwarfism. He sought help as the bell in the room was not working. So in the middle of the night, this other patient saw Freud hemorrhaging, knew it was serious, rang the bell, there was nobody there, and went to find somebody to help. We don't know who this person is, but it's very likely this person saved Freud's life. Martha and Anna returned the next day to find a dazed Freud sitting in a chair covered in blood with no doctor or nurse in attendance. Anna refused to leave. Jones records he was weak from a loss of blood, was half drugged from the medicines, and was in great pain. The next night, Anna and the nurse became alarmed at his condition and sent for the house surgeon, who refused to get out of bed. The next morning, Hajek demonstrated his case to a crowd of students, and later in the day, Freud was allowed to go home. Freud wrote to her friend, "I can again chew, work, and smoke." Notice his intention to resume smoking and work. Freud was referred for X-ray treatment and radium treatment still in its infancy outside the Institut Curie in Paris. After the radiotherapy, Freud was given, quote, "a series of radium capsule treatments." Radiotherapy interfered with scar contracture. This haphazard treatment caused Freud further tissue damage and violent pain because Hajek had not taken preventative action for scar shrinkage, which limited how far Freud could open his mouth, nor had he removed all the cancer. Freud was in such pain while on holiday that Anna insisted he summon his personal physician, despite the fact it was a 12-hour train journey away. After seeing him, Deutsch knew a second and more radical operation was required. So in August, he met with a small group of Freud's key supporters, known as the Secret Committee. And later, Ernest Jones confessed to Freud that they had discussed his cancer, but had agreed not to tell him the diagnosis. A very angry Freud said, with what right? Deutsch resigned as Freud's physician. Freud's only respite was a trip to Rome. Freud absolutely loved Rome. He felt so at home there. Somewhere he said at one stage he would like to retire to. And he was taking his daughter Anna to show her the sights of Rome. And that was something that cheered him up. It gave him a hope of something to look forward to after this initial operation. But on the train journey home, he suffered further hemorrhaging. And at this stage, Freud was told the truth. He had cancer that required a second operation, including the need for an obturator prosthesis. This is what they looked like. This prosthesis covered Freud's palate, gums, and teeth, following the removal of part of his upper jaw and soft palate. The best surgeon, Prof. Pickler, was employed, but even he was overly optimistic, promising Freud that within 4 to 5 weeks, he would be able to eat and talk satisfactorily. Freud was equally optimistic and only postponed his patients until the 1st of November. What the surgeon found was much worse than he expected. And Schur offers the following account of the extent and seriousness of Freud's cancer. Let me just see if we can get this. In addition to a large cruciform ulcerated recurrence on the right soft palate, the tumor had spread towards the cheek and the lower jaw. On the 4th of October, under local anesthetic, the external carotid artery was ligated and extensive dissection of the submaxillary and jugular glands were performed to prevent a spread of the cancer. On October the 12th, 8 days later, again under local anesthetic, Freud then experienced another piece of radical surgery consisting of a resection of the major part of the right maxilla, a considerable part of the mandible, the right soft palate, and the buccal cheek and lingual tongue mucous membranes. This was a radical operation performed under local anesthetic. On November the 7th, he noticed a slightly ulcerated spot under a tiny necrotic part of the graft and took a biopsy. By November the 12th, he received the report it was still malignant. The operation was performed the same afternoon. There was a further resection of the mandible and soft tissues. And so the extensive surgery made a really satisfactory prosthesis impossible. The result, I'm quoting, was a life of endless torture. Eating, smoking, and talking could only be carried on only with great effort and pain. If the prosthesis was right for the proper occlusion and separation between the oral and the nasal cavities, the result was sores and pressures on the mandibular joint and often intolerable pain. If some of the prosthesis was removed, speech, eating, and smoking, but could only be removed. It became much more difficult. But this was only the beginning. Freud could not overcome his addiction and give up smoking, which caused a constant irritation and provided the stimulus for formation of new leukoplakias. Thus, in 1926, he began an endless cycle of leukoplakia proliferation, precancerous lesions. Each one of them had to be treated surgically. This happened more than 30 times. Only in 1936 was one of these lesions malignant, and only in 1939 was such a lesion so situated it could no longer be reached surgically. These quotes come from Hans Pichler's medical notes, which make harrowing reading. 25 pages long, they offer detailed insights into the extent and trauma experienced by Freud's cancer and its aftermath. They record 74 visits to Pichler in 1924 alone. Despite this, Freud resumed seeing patients, although life would never be the same. By 1932, Freud saw Pichler 92 times. Anna proved to be an excellent nurse, companion, and colleague, with Freud realizing for the first time what good company my little daughter is. Anna wrote regularly to Freud's psychiatric colleagues, keeping them in touch with his progress. So Freud writes in 1928, "I am living naturally better and more independently than before, with an approximately 70% improvement in my prosthesis. Psychological laws unfortunately demand that I feel the remaining 30% all too markedly." Freud's cancer now dictated his life, although he had other health concerns like a heart condition, several bouts of severe influenza and pneumonia. Freud's health concerns limited travel, apart from local holidays, attendance at conferences or public events, such as a presentation of the Goethe Prize, or even attending the funeral of his mother. In 1929, he visited Berlin to have Professor Hermann Schroeder do more specialist work. He also sought help from an Armenian-born American colleague called Professor Varaztad Kazanjan of Harvard University, a pioneer in the evolution of plastic surgery. He was famous for his innovations in perfecting the best dental prostheses designed for patients with seriously disfigured faces. Thus, Freud was able to benefit from the progress in facial surgery following the First World War. So in 1931, and at great expense, about $6,000, which is approximately $120,000 today, Kazanjian produced several smaller, better fitting prostheses, allowing Freud to speak more clearly. But these were discarded because they prevented him from smoking. Freud spent 6 weeks in Vienna, seeing Freud up to 3 times a day. Now, an academic colleague, Lana Lynn, has written a very thoughtful book, which I shall quote from later. This is called Freud's Jaw and Other Lost Objects, the subjectivity in the face of cancer. The technical challenges were immense in order to provide something that could really help and assist Freud. But apparently, according to Lynn, smoking is a technical challenge more complex than speech. So he could have a prosthesis that would allow him to speak. He could have a prosthesis that could allow him to eat. He could have a prosthesis that would allow him to smoke, but it was therefore difficult for him to speak and to eat. And so they were forever changing these different issues. And the other is because of the contracture to his jaw, Freud's jaw could only open a certain amount. And later on, what he did was he had a wooden peg fashioned that would, in the best accommodation of these prostheses, he found one that he could do just about enough with to eat and to speak. He fashioned a wooden peg that would force it open physically large enough so what could fit in? A cigar. But overall, Freud had 10 prostheses made, and he called them damned prosthesis, horrible monster, instrument of torture, ill-fitting object, the intruder. And because of this constant activity, and because of ill-fitting, it had to be removed and cleaned every day, a process which could take up to an hour, and which only Anna, his daughter, was able to do. But Freud was he was asked about his health in 1934. Somebody had said there was news circulating about his poor health, and Freud said all such reports are false. But in 1935, he wrote to the novelist Arnold Zweig in melancholy mood, all too aware of his defective speech. Since I've not been able to spoke freely, I no longer wish to write, or perhaps I only use this as a pretext to veil the unproductiveness of my old age. Moses will not let go of my imagination. Moses was the final book examining his Jewish identity and religion, published as Moses and Monotheism. But following the annexation of Austria to Germany in March 1938, it became clear that Freud's life, and more importantly, his family, were in danger. Through considerable political pressure and at great financial cost, Freud and his immediate family came to Britain. Freud's 3 elderly sisters that remained in Vienna all died in Nazi concentration camps. On arriving in London in June 1938, Freud was encouraged to seek a second opinion. Well, of course it would, because being British, we always assume that, we can do something better than any other country or any other nature. So just in case all these worldwide American, European experts had got it wrong, he did get a second opinion. He writes in July 1938 to Anna, he said, quote, "Radium man due today." Radium man was Dr. Carter Brain, later director of the radiotherapeutic department at Guy's Hospital in London. In September 1938, Schur, who had accompanied Freud to London as his personal physician, found another growth. Pichler came to London to do the operation, which required dividing the lip and cutting the nose to get access to the tumor in the cheek. Freud then wrote to a friend. In a letter a month later, Freud said it was the most severe operation since the original radical one in 1923. He said he was frightfully weak and tired still and found it hard to write or talk. He never fully recovered from the effects of this severe operation, becoming more and more frail. And this is a picture of Freud taken in 1939. Some people thought that Freud was a melancholy, sad person because of this scowl. He wasn't scowling. That was as much as he could do. And certainly that became worse over this period of time. So he wasn't stern. It was agreed in 1939, when another growth occurred, that they decided that Freud couldn't be subject to another operation. There was nothing more he could do. This is an X-ray taken in Britain, which shows, to some extent, you can see the whole area that is. So I've moved away from the microphone. The whole area and the extent. So you can get some idea as to how extensive and how awful this is. Freud wrote, "The radium once more has begun to eat in with toxic pain and toxic effects, and my world is again what it was before, a little island of pain floating on a sea of indifference." Freud knew his time was fast approaching when his ulcerated wound gave off such a fetid smell that his beloved dog, a chow chow called Lun, flinched from coming near him. His doctor records metastases and extension of disease into eye socket in May 1939, before adding in his notes, death on the 23rd of September 1939, after being unconscious for 24 hours. The remorseless march of cancer caused by Freud's addiction to cigars came to an end when Schur, as requested by Freud and agreed with by Anna, gave him a lethal injection of morphine to end his pain and suffering. So Freud's cancer story is one of addiction, denial, flawed thinking, medical experimentation, arrogance, stoical suffering, silent voices, a flirting with death, and despite it all, creativity. Freud produced some remarkable books during this period. And I just want to pick up one or two of these. Freud both benefited from and suffered at the hands of the medical profession. Hajek's arrogance and incompetence were balanced by Pichler's compassion and skill, even if he was still far too optimistic. A recent re-examination by Dr. Nadia Ben Moussa and colleagues has been published as the misdiagnosis of Freud's maxilla osteoradionecrosis. It would help if I was a medic, because I could at least pronounce these things properly, which is a rare complication from radiation therapy to the head and neck that can cause bone death. So their work, based on Pichler's notes, record the number of interventions that Freud had. So 6 X-rays, 12 applications, adjustment to the prosthesis, 52, local electrical calculations, 28, local surgical revisions, 23, extractions and dental care, 8, biopsies, 9. Sorry, biopsies, 8. Having checked the amount of radiation Freud received with a professor in clinical oncology here in Oxford, he said, while the total dosages are about the same as today, this would have been, this would be much more finely calibrated. And the likelihood is that Freud experienced much greater side effects, as they had very little idea what actual doses they were giving them at the time. The side effects included loss of hearing, restriction in the movement of the jaw, chronic and persistent pain, chronic inflammation of the digestive system, multiple dental lesions, tooth extractions, post-operative infections, and migraines. So some reflections on this. Let me just go back a page. I think, first of all, it's that addicts are difficult to work with and to live with. Freud was addicted to nicotine, and that was to have terrible consequences in his life. But as some people have indicated, as some people have said, somehow it was mitigated by the fact that Freud still was able to view this as a source of his creativity. He somehow, while he may have been addicted to one thing, the mitigating fact is that Freud was even more addicted to writing and promoting psychoanalysis. And beyond that, everything else paled. Addicts are difficult to work and to live with. Secondly, I've outlined Freud benefited from the hands and suffered at the hands from the medical profession. But thirdly, Freud incorporated the idea of the prosthesis as part of the human psyche. Freud developed the idea that the prosthesis can be a figure that becomes part of one's mind, one's psyche, one's internal world. And there are times when you need additional external support to hold all aspects of that together. In one of his books, Civilization and Discontent, he said, man has, as it were, become a kind of prosthetic god. He puts all his auxiliary organs, when he puts all his auxiliary organs, he is truly magnificent. but the organs have not grown onto him, and they still give him much trouble at times. So the idea was that man believed himself to be complete and to become like God, but in actual fact was always doomed to failure in that regard. I could say more about that. So exactly what a psychical prosthesis is very different. And that's something I talk about with my students. And what do we need in a psyche that will help us? But the way he thought about the whole of the human being, he viewed that we have got elements to us that are both known and unknown, conscious and unconscious. And we work this out in relationship to and through others. Freud could not have done what he did without so many people, and particularly from his cancer onwards. He did become that person that was truly dependent on others. And for someone who was notoriously independent, that was no easy thing to do. The other reflection is that the experience of cancer can fracture a psyche. I return back to something I said right at the start as I draw to a close, which is that cancer itself is an existential threat. The idea that a part of our body can turn against us and kill us is profoundly disturbing. The experience of cancer challenges who we are, what we think, what we feel, what we experience in our own bodies. We have a whole set of new questions that enter our mind. We become robbed of the assumption that we will live well and into old age. We reassess our priorities. And that's why psychological support is essential for a holistic well-being of a cancer sufferer, and particularly, and this is often overlooked, of their families. Because a bit like going back to addicts, families who live with addicts experience the addiction, but in a very different way. So Freud had cancer. It changed his thinking, it changed his life, it changed his experience, and yet he found within himself the determination to continue to go on and on and on, because he believed he had something to do, something vital to tell the world, and he did it to his very dying days. So reflecting on this, I think it's important that Freud's cancer story is told, because it forms a vital part of the life and death of one of the most influential figures in the 20th century. And at that point, I shall stop and hope that there's going to be some questions. Oh, sorry, the hope is that there are going to be some questions that I can actually answer.
I have one actually, Alistair, if I may. Thank you, such a fascinating talk. I think I was just really reflecting though the whole way through that, how much the smoking was so central to this whole process, and what kind of meaning it really had beyond just the act of smoking, what kind of meaning it had for Freud, so that it meant that sort of transcended all of the medical advice, presumably, you know, the pleas of his family, why that was so key to his existence.
Okay, I'll come back to that. If somebody could just come and get me out of this screen here, so that people can, just it's the end slideshow, is that the one? So I'm just trying to come out of this. Right, you can do that. So, Rebecca, have you put? Oh. Right. So I'll just you can see on the screen. There we are. That's a really good question. It's very difficult to answer because it eats into, and that's not meant to be a pun on cancer, what is addiction? Because at the end of the day, so I appreciate that many of us grew up in a context where it would be normal for people to smoke. It's only in more recent times that that has changed. There are still people who smoke. This is not an anti-smoking lecture in that way, but there are consequences for that. But when something becomes an addiction, it is an addiction, and the research about addictions is very divided. There's some kind of research that says there is an addictive personality. Is that, you know, they will get with one addiction and then they'll get over that and they'll go into another. There's some addiction, particularly around alcohol, that some people become immediately addicted from their first taste of alcohol. It just does something to them. The third case, which is probably much larger, is that it's acquired over a period of time where the object we are being addicted to acquires a psychological significance and contributes to our sense of self. And it clearly did. Freud linked it with creativity. And it may well have been that he was a medical student when he was at a young age. His mind was beginning to just grow in this fascinating intellectual world. And that may well have had a huge impact, that he linked that with that opening up of possibilities. But I have talked about this with another Kellogg student, Dr. Olivia Gein, who's Canadian, and she works with an older population. And she made a really interesting point. She said is that sometimes the deals we make with ourselves when we're younger become much more complicated, much more difficult when we become older, when we're living with the impact and the effects of that. But great questions to start. Question here.
Thank you for your talk. It's very interesting. I was wondering about whether addiction can be tackled by psychotherapy and psychoanalysis, because Freud would be, I mean, he had his own insight into himself, but presumably he was in analysis through much of this period you've been telling us about.
There's three answers to that really good question. The first is psychotherapy can help in a number of different ways. Sometimes with particular things like addictions or obsessions. Sometimes a cognitive behavioral therapeutic approach has got something really valuable and helpful to contribute at one level, but that focuses on the symptom and the eradication of the symptom. Other forms of psychotherapy can help because they want to look how the past influences the present, because what they're looking for is meaning. What is the meaning of this to me here and now? And what once I understand that meaning, that then gives me some choice as to whether or not I'm going to do something with this. Thirdly, is because Freud invented psychoanalysis and lying on the couch, he did his own self-analysis and was never analyzed by anyone else, apart from the whole host of people who have written on Freud, and yet thousands, if not, I won't say millions, but certainly thousands of books on Freud who are still trying to work out this conundrum. Why is it that he did not have this insight into himself? Well, because we're human. I do work as a psychotherapist. I have great insights into other people. I'm really good with patients and clients. But sometimes I just do really remarkably stupid things that you would think, haven't you learned by now that, you know, if you do that, that's what the outcome is going to be. So we all have blind spots. They're all parts of ourselves. And sometimes, and this is where psychoanalysis would help, sometimes there are parts of ourselves that we really, really do not wish ever to come into the light. So they exist within us. And we have almost some awareness of them, but they are unconscious. And we never quite know what they are until they make their presence felt. Thanks.
We're talking about addiction. Save me shouting. Talking about addiction, I mean, I suppose it's about the pleasure of smoking the cigars or drinking alcohol continues to outweigh the pain. Do you think that's part of it?
I think that the bigger part of it is that it forms or becomes part of your identity, and therefore not to do it means you're not being you, or that's how you experience that. So yes, there must be some pleasure. So for instance, when they were trying to develop techniques to deal with addictions in the 1960s, sometimes they would give people overwhelming amounts of alcohol so that they got to the point where the taste was awful, and they were given drugs that would make them feel physically ill if they did. They're not generally very successful. Successful with some people, but obviously not with others. So yes, there is still that pleasure. I don't smoke. I think I probably smoked 4 cigarettes when I was a teenager because I wanted to be like everybody else, and thought after being sick, no, this is, there must be other ways of being cool. It's just that subsequently I haven't still worked out what that actually is, or that I am. But however, I do like wine, and I do still get great satisfaction of hearing that point where you take a cork out the bottle and you hear that sound. And so in that sense, that is still enjoyable. That's a sound that I associate with pleasure. Sometimes you have to put the cork back in the bottle, but so again, I think this is very, very multi-layered, but you are right. There must have been some ongoing pleasure. There's a psychological element, but there's also an addictive element. Alcohol and nicotine can be very addictive, as can coffee or tea or many other things that we take. But good.
I think we've got time for just one more question. That's okay. We'll have one through the chat.
Yep, that would be great from the chat. Thanks, everybody.
So the question is, what has the psychological community learned from Freud's response to his illness? So what has the profession learned from Freud?
Not very much, because Freud's cancer is rarely talked about. I mean, yes, it forms part of all the standard biographies, but thinking about the impact of that addiction and Freud's cancer, I think that we haven't learned very much from Freud. I think, however, from the profession of psychotherapy and psychology, we have learned a huge amount about providing psychological support to people who do have cancer and families who are supporting them, because people need to talk it out. People who have cancer have a cancer story, and therefore they want to talk it to somebody who isn't necessarily a professional. Because if you're a professional, you want to know technical questions, and it's as if the person is treated as a successful outcome of a form of treatment. Whereas I think the best way of working is both using your medical knowledge to listen, to probe, but also to hear what the person wants to say. So what we do know is that where there is appropriate psychological support, remission rates are better, and adherence to treatment regimes is better. And so my daughter is a clinical psychologist in Yorkshire, and she runs a range of psychological supports across health specialities. But the first one that she started out was in oncology. And she was able to prove that providing psychological support was of cost benefit, because more people turned up for appointments, they weren't late, and they were able to make sense of this awful experience they were having.
Thank you. I'm going to come join you up on stage now to formally thank you. So thank you so much, Alistair, and thank you for joining us in the room. And I'm also just going to say to our audience online, thank you so much for joining. It really is great. We have so many people from so many locations around the world. So thank you very much for joining us. Okay, thank you,
very
Alistair.
much. Thank you.
Thank you, Alistair.